Okay, go ahead.
The fear of death is a very universal fear. People, as long as there have been people, have always been afraid of death. But I think men of the 20th century, especially in the United States and Canada, are a bit more afraid even of death than they used to be in the old country, or maybe here 100 years ago. There are many, many reasons for this. Psychologically, in terms of our unconscious, we cannot conceive of our own death. It's very hard for us to imagine that. We are very afraid of death as a catastrophic happening that happens to us from the outside in an unprepared, unexpected way. And I think the reason that we are more afraid now is that man has created weapons of mass destruction and has created the very thing that we are so afraid of, that we are so petrified of, and that is a death that happens out of the blue skies, that we can't see, we can't hear, we can't prepare ourselves for it. And you get more afraid because you can't defend yourself physically. And what you do when you're very afraid that it can happen to you too, and you can't defend yourself physically, you defend yourself more psychologically. You can deny the reality that you too have to die. Also in terms of belief in life after death, I think in this generation there are many, many less people who really genuinely believe that there is a life after death. And therefore, no hope, no purpose in living a especially meaningful or good life here. If there is nothing afterwards, what's the sense in dying?
What's the sense in dying? Those were the words of Dr. Elizabeth Kubler-Ross, a professor of psychiatry at the University of Chicago, who has spent the last 4 years studying how it is to die, today in a North American society that denies the reality of death.
If the fear of death is taking on such extreme forms, you can imagine that the patient himself who is dying suffers tremendously. And this is something we see in the hospital every day. Very often a person, when they are beyond medical help, are suddenly seen like they're bad people because they remind the healthy and the living of our mortality, and they are treated then like they have a contagious disease, as if sheer closeness would kind of be dangerous. They are very often isolated. They are most of them are very, very lonely. And people come in and make little jokes and want to talk about anything else, but not about the reality that this person is in the process of dying. And patients who are dying have tremendous needs and unfinished business and want to talk with a human being and be accepted as alive and human with needs that every human being has. And very, very few people are comfortable giving that to them. In the old days, people used to grow up and see birth and death because children were born at home and the family was able to see the birth, to experience the birth at home. Now it's depersonalized. It's in the hospital, and after a few days, mama brings a bundle home, and that's a new baby. That's very different. Death the same way. When people are sick, they used to be at home. The family kind of pitched in, took over the role gradually. They used to cook a good soup and spoon-feed the patient a few spoons at a time of the home-cooked vegetable soup that smelled so good, that was familiar. The dying patient was allowed to be in a familiar environment in his own bed, and the family was allowed to go through what we call a preparatory grief, to face day by day that the patient got weaker and was able to do less and less and less. So when this person died, the family was well prepared for it. The children were not sent away. They too were allowed to take part in this preparatory grief. But they too were able to pitch in and do many of the tasks that the dying mother or dying father used to do. So they took an important part in this whole process of separation. If you compare this with dying nowadays, where when a person gets very sick, they are immediately rushed into an ambulance to a hospital. In the emergency room, the patient is faced by an internal and external resident, a lab technician, an X-ray technician, a nurse, by a lot of people. Very few of them ever introduce themselves. They're all very busy in a depersonalized way to check the blood pressure, to check the pulse, to take blood, to take X-rays, all with the purpose of stopping the process of prolonging this life, but at the cost very often of an interpersonal relationship, of asking the patient how all this feels, of taking a moment out to ask the patient even, does he want all that? Would he have much preferred to stay at home and die a natural death at home in his own environment when his time was up? Very, very few patients are ever asked. Maybe I'll tell you a little bit how we learned about this from dying patients themselves. About 4.5 years ago, when I just started my work at the University of Chicago, 4 theology students knocked at my door. They came from the Chicago Theological Society, and they had to write a research paper on crisis in human life. They could pick anything they wanted, and 4 in the whole class chose dying as the biggest crisis human beings had to face. And this was naturally accepted as a research paper, but then we were stuck. How do you do research on dying? I told them that I think the only way they can really learn what it's like to be dying and what dying patients needed, how we can be more comfortable and effective in their care, was to ask dying patients to be your teacher, explicitly, to admit we know very little about it. You are the one who's going through this experience. Can you share some of it with us? That sounded very simple. And the students agreed to meet the following week at the same place, and I volunteered to get the patient and to interview this patient and ask him to share with us what he's going through. That was the end of our simple life, because the following week, searching through a big hospital of 600 beds, there was no dying patient. I'm in absolute denial that there was anybody in this hospital that was dying. Doctors said they have no dying patients. Nurses said they have nobody dying on their wards. But I knew better. It wasn't true. And this, too, is a sign that even people in the hospital who are among dying patients all the time really deny the reality that their patients are dying. And the patient senses this. The doctors have rounds outside the patient's door. The relatives come in, sometimes with red faces and swollen faces, and have an artificial smile. And then they go out in the hallway and cry. The families tell us, I know he has cancer, but don't tell him. The doctor tells us, I know he has cancer, but he doesn't know, so don't tell him. And the patient tells us, I know I have cancer, but my family and my doctor don't want to talk about it. So everybody plays kind of a conspiracy of silence, and very, very precious time, and sometimes the most meaningful part of a person's life is wasted by playing a game and by non-communication. And we have seen this with couples who have had 25, 30 years of a marvelous marriage and have really shared good and bad together, and at the end, before one of them dies, they play a game together, and I find this very sad. And all it takes then for one person, and it doesn't matter who it is as long as that person feels comfortable, to be kind of a catalyst, to tell the patient, look, your family knows, your doctor knows, and you know. Why don't you open the gate and communicate and share it with them? It will make things so much easier. And you should see the relief of anguish and pain and tension when they can finally talk together about what really bothers them. There are 2 things that our patients resent, and I'm generalizing a bit from what we have learned from all 400 patients. They like to be told, but they don't like to be told that it is hopeless. They don't like to be told it in a black and white fashion. They like to be told it is serious, but. And the but they want to hear is, no matter what, I'm going to stick it out with you. I'm going to take care of you. I'm going to try my best to make it comfortable and to give you all possible treatment that is available. If they are told black and white, as if there were no hope at all, they become very, very depressed, and they usually die a very painful, uncomfortable death, very much in contrast to those patients who have been told with a sense of hope. When a patient is told of a serious illness, they usually go through the first stage, the stage of shock and denial. They say, no, not me. It can't be true. This doctor must have made a mistake. It's the wrong X-ray or the wrong slide. And if you at that time try to reason with them or tell them or show them the X-ray or prove that they're right, they can't hear you. And I think it's cruel to kind of rub it in when it is so obvious that the patient can't hear it. It is enough if you tell them once, and when this patient is ready to talk about it, he will then come back to you and talk about it when he's ready, not when you are ready. This is when the patient begins to drop his denial partially and usually enters the second stage, during which time he does no longer say, no, not me, but he raises the question, why me? And this is a time when patients are angry, when they are sometimes very obnoxious, when they are very ungrateful, when anything you do is no good. And what we try to help the patients with is to express this anger, to ventilate it, to pour oil in the fire and say, express it, express your anger and rage. If you want to scream, scream. I'll help you express it. You have to express it in order to feel peaceful and things are all right. The stage of bargaining is a time of truce, in a way. The anger has subsided and the patient now thinks that he has a way out. He does no longer say, no, not me. He has stopped asking, why me? But what he's saying now is, yes, me, but. And the but says something to the effect of, if you give me one more year to live, I'll be a very good patient. They ask God for an extension of life in exchange, perhaps, of being a good Christian, of going to church every Sunday, or they may want to donate their kidneys or their heart or something to people who are in need of organs when they have died. The promises that those patients make during this time are very hardly ever kept, but that's not important. It just gives them a little extra time and a little hope that if they are very good, they may have another chance, like a second chance. If you don't try to shake their denial, if you accept them to deny when they need to deny, if you help them express their rage and anger without feeling guilty or ashamed or not good Christians, if you don't ridicule them in the stage of bargaining, then these patients enter the fourth stage very soon afterwards, and that's a stage of depression. They say, no longer yes me but yes me. It's me who is going to die, and that is very sad. I can only compare this with our tolerance of people who have lost a next of kin. If I were to lose my husband today, everybody who hears me today would regard it as perfectly normal if I would put on a black dress, if I would be in mourning, if I didn't want to socialize, if I would cry, if I would go through a severe state of grief. The society in which we live is very tolerant for the widow or the widower who has lost one loved person. But we have very little tolerance for the dying person himself, who is in the process not of losing one loved person, but every person he has ever loved in his whole life. And if he has the courage to face his own finiteness, if he is courageous and bold enough to face it is happening to me, I am now in the process of losing everything and everybody I have loved. It is tremendously sad. It is a tremendous separation. And I think those patients have to grieve. They have to go through what we call a preparatory grief to make the separation easier and more comfortable. But you see there again, what we interfere with is we cannot tolerate a long face. We cannot tolerate the sad patient.
Hello, how are you? I'm going to be one of the nurses they work in here. How are you feeling?
Don't feel so hot.
No, what's wrong? You look great, though. Your hair is combed, the knife just sitting up. Are you sure you don't feel good? You're looking very well to me. You're holding the glass of water. You could do things for yourself. Do you have anything to say?
Why don't you just call me when you need something, okay? Right?
Great life.
There are two kinds of grief that those patients go through. First, they grieve in a loud and noisy way. In a way, they are expressing a mixture of anger and sorrow about, look, I can't lift my arm anymore. I have to be washed, I have to be fed, and who is taking care of my garden and my geraniums and my children? But soon after this kind of expressive grief, where they want to talk and be talked to, comes a silent grief, where they don't want to talk anymore, where they want to be left alone, where they are still sad and they still have tears, but it is an inward kind of a grief, a lonely preparation to separate themselves from this world. And this is when they go through the preparatory grief and what we call in psychiatric terms tikaphexis, which really means a slow, gradual separation from everybody they have loved. This is when they reach the stage of acceptance, where they are saying, yes, it is me, and gradually are able to say, it's all right, my time comes very close now. We have to have the courage to look at our own reactions and learn to differentiate how much is it our own inability to face this patient's death, how much is it our own need not to be a failure, to prolong a life, when deep down we know that this patient's time has come. I think this is awfully difficult, especially for physicians, and especially in a time when we can transplant hearts and kidneys and perhaps livers and prolong a life for many, many months in a person that was perhaps meant to die much, much earlier. But not all the patients are grateful for this extension of life. And I think we have to learn to differentiate whether we are doing the things we are doing for our own needs, for our own inability to face it, or whether we are really doing the patient a service. Then I think decisions are much easier to make, who shall die and who shall live.
That's all.
I think what we have to do is to come back to helping people realize that death is part of life, a very intrinsic, very important part of life.
That philosophy of death, Dr. Ross takes with her to an interview in a Chicago hospital with a 30-year-old man who only 10 days earlier was diagnosed to have Hodgkin's disease, which is cancer of the lymph glands.
You had a lump
Yes.
on your neck,
right,
and then
right.
you went to the doctor and he took it out.
Right.
How were you told that it's Hodgkin's disease?
He said he had a thought that this possibly was a Hodgkin's, you know.
What did that mean to you?
Well, at that time it didn't mean anything, but I went home and found out.
How did you find out?
Me?
How?
Well, there's Merck's medical books, you know. I mean,
Yeah.
I got them out and read about them. I want to find out what it is.
How did you react to that?
Well, it's just, how would anybody react? I mean, this is part of living. It's part of what you, there's no use trying to hide it or worry about it because it's there.
What happened next after you were told? Did you share? Are you married?
Yeah.
You have children?
Mm-hmm.
Did you share this with your wife or with your parents
yeah,
or with
well,
anybody?
Not completely with my wife, no, because she worries. See, she would worry whether the sun's coming up tomorrow or not.
I
But
see.
I don't. If it comes up, fine. If it don't, we'll have to be fine.
So she's very different from you.
Yeah, but I just slowly, you know, the word finally leaked out to her as to what it was. I mean, and by that time, I knew a little bit more about it too, see. So, and then it didn't really shock her that much either. But if it had come out all at one time, it would have likely been maybe a little shock for her. Yet my kids know nothing.
Yeah.
Exactly.
How old are they?
The oldest one is 9, and then there's one 7 and one 5.
They are a bit young
Yeah.
to understand those things anyway.
Well, the oldest one would understand it. She
What
would.
are they, boys or girls?
All girls.
3 girls.
Yeah.
What are you doing for a living? Are you somebody's home a lot or on the go a lot?
What do I do for
Yeah,
a living?
yeah.
Presently, I'm a truck driver.
Does that mean you're gone all week and home on the weekend?
I'm usually home 3 times a week.
Are you a close-knit family who usually shares things, good and bad?
Yeah, no,
Or are you somebody who keeps things inside?
I don't know. I usually spill the beans. Yeah.
What does it feel like now for a man like you who has been a truck driver and working to the last day to be hospitalized?
Oh, I don't like it.
What's
I
the
mean-
worst of it?
No, it's just, I don't know, really it's a vacation, actually. I mean, I don't really enjoy, I like to work. I enjoy working. And I would like to go to work today. But, you know, I realize there's things that has to be done. And this is part of it. So consequently, I have to be here.
Yeah. What kind of restrictions are set upon you now?
Right at the present time?
Yeah. What can you not do that you have been doing 10 days ago?
Well, right now I can't smoke. And I can't have hardly anything to eat. And I can't have coffee. The main reason being is they are to have an exploratory surgery tomorrow. And, you know, there's certain things you have to go through before any time, before
Are
any
you a
surgery.
big smoker and a big coffee drinker? Or
Well, I'm not too big a smoker, but a very big coffee drinker.
how big?
From 10 to 15 cups a day. I mean, I think that's quite a bit.
Yeah.
I don't know.
Well, I can shake hands with you in the same way. How many cigarettes?
Usually around a pack.
A pack a day.
Some days I'll go more, but then there are days when I'll go
Yeah.
less than a pack.
So from one day to the next, those things are taken away, and that's hard to take, isn't it?
I don't know. It's part of it. I mean, I don't exactly like to give up my cigarettes because the fact is I got caught a couple times cheating this morning. So
What do they say when they catch you?
and shake their head, frown, and tell me this for my own benefit, you know. And at one time they were even thinking about postponing the surgery
Because of that.
because of the smoking.
What is this surgery all about for you? Is this something new that you have never experienced, or have you had any surgery in your life?
Not much.
Not much.
The only surgery the only real surgery I ever had was when I was very young, I guess 9 years old, 8 years old. I had a little cyst here that was cut open, and they lanced it, and but then they put me to sleep, you know. And this biopsy, which was only 2 or 3 weeks ago, I mean, all hospital routine is sort of foreign to me because
Because you have been so healthy. How far back do you remember when you were tiny?
I can remember the winter before I started school, I used to ride the school bus route with the driver. Only in those days, it was not a bus. It was a team of horses, a bobsled, and I can remember this. To me, this was one of the greatest things happening.
Yeah, I can imagine for a 4 or 5 year old. Did you grow up in the country on a farm or in the city?
Country.
On a farm. Was your father a farmer?
Yeah.
What kind of a man was he, or is he?
Well, it was not my father. It was maybe my stepfather, because my father passed away when I was 2 years old.
Do you remember anything about him?
No, nothing. But my stepfather was a quite rough, but yet soft and gentle type person. You know what I mean? He had a real loud bark, but he didn't bite really too hard. And I don't know, he liked to drink a little bit. And he was a smoker. There was myself and a half-brother, and a stepbrother, and 3 stepsisters.
What is your mother like?
What is she like? A working woman. What is any working woman like, you know? She buys on credit, and she pays for it, and she, you know.
How is she with you? Did she treat you in any special way since you were...
No, she's my mother, but she's still, I mean, we're still 2 people, too, you know.
What is planned in terms of treatment, do you know?
But, I guess daily radiation.
Does it scare you? Or?
No.
No. Do you take everything like, if it happens, it happens?
Well, I mean, just a minute, you know, there are some things I can control. But there's no control whatsoever on whether or not this man was going to get Hodgkin's disease.
Yeah.
Is there?
No.
I had no control of this.
No.
I mean, medicine doesn't even, don't really know what causes it even. So how can I control?
Yeah.
I mean, but it is something I have got to accept.
Yeah. Has anything in your life ever happened before that was beyond your control and that you were able to accept just like that? Have you been in a war? Have you been a soldier?
I've been in service, but I was never in any war.
Are you a religious man?
Well, yes, no, not really. I don't know. Sort of a hypocrite, really.
Yeah. Or can you be more specific? Is there a God or a heaven or
Oh, yeah.
a life after death?
Yeah, I would say there is, most definitely.
Has this illness changed anything in your religious kind of thinking?
No, but I believe maybe it should.
Do you ever ask God or yourself or anybody, why does this happen to me?
No.
No. You never question. You just accept.
Well, I mean, it happened. I mean, I have no... I don't know. I don't think that I have anything so great or am anybody so great that I should ask, why does this happen to me? I mean, who am I? I'm just one of, I don't know,
a billion.
Other people. That's and this is all there is to it. If I were anything in particular, then maybe I would ask this question. I don't know. Maybe.
What's the worst that can happen?
Worst that can happen to me?
Yeah.
Well, I can die.
Yeah.
That's...
What does that mean? Does death mean anything special to you?
No,
like all of us have a certain concept of what it's like. Or...
I don't know. I've never been dead.
I know that.
But I don't know. It's possible that it may have a definite meaning, but I can't really say that it bothers me too much to think that...
You're not somebody who has thought about what it's like, you know, through an experience of a friend or somebody.
No.
Did you ever raise those questions?
I mean, here's the way I look at it, you see. They tell me, or medical journals and things like that I've read, say that this disease, if it is uncared for, the average a person can expect out of life is between 5 and 10. Well, 5 years. I got another 5 years to live at any rate. So I don't really feel too bad about it. Maybe when it's 4 years, 364 days, maybe I really would be worried. I don't know. I wouldn't say that I wouldn't be.
And you
But
know,
today I'm not.
yeah. One more question. I hope that you have some, perhaps. If you could have 3 wishes, I mean any wishes, they don't have to be reasonable, what would you wish for? Anything.
I to be truthful about it, there's nothing that I don't have already. What could I wish for? Money. And money makes problems. And problems makes, I always had always believed that there's only one person that can have an ulcer. And that's the rich man.
Who worries too much.
Because he's the only one that has, for one thing, he's the only one that's got enough money to pay for one. For another thing, he's the only one that has reasons to get one. Because he is worried about his money. True, it might be nice to have a lot of money, but then sometimes I wonder if it would be. Because
just so much headache as it is nice.
That's right. I don't want for a meal, and I don't want for transportation, and I don't want for a roof over my head. These 3 things I have. Really, what else is left? Good health. Yes.
That would be one.
That would be one wish, I would assume.
Yeah.
But so far in my life, I have never been.
You've had that too?
I've had that.
Yeah.
See.
Yeah.
What else? I don't really know what I would want.
You know, as young as you are, you're only 30 years old, right?
I'll be 31 in a few more days.
In a few more days?
In February. It'll be another 2 months.
For as young as you are, you've had a very meaningful, good life.
Oh, I think so.
And I think that helps you tremendously getting over this crisis now. And not taking it like the roof is falling in.
Well, I've always felt that if anything should ever happen to me personally, then I've lived a very good life so far. I mean, I've heard people say, well, I'm 90 years old. I've had a full life. Well, this is true. Maybe
but
that.
You're 30 years
but I
old
think I have had a very good life for 30.
Yeah. Yeah.
Of course, at the age of 14, I was very much on my own, in a way. 14, 15 years old, and I've been traveling around the country ever since that age, really.
What happened at 14, 15? Did you leave home?
No, yes and no. My folks, my stepfather has relatives who live in Western Canada, Alberta, and we went there for vacation, summer. I enjoyed it tremendously.
That's Calgary, Alberta, up there?
Wow, it was 120 miles north of Calgary. It's a small town of Ponoka.
Looks a bit like Switzerland?
No, it's not that bad yet. This is still part of the plains. It's rolling, but it's generally, on a general basis, it was flat country on an average. Yet it's rolling with sloughs, but then you go west of there, 30 miles, 20 miles, and it begins to get like this. And you go 50 miles, and it really gets high and low. So it's right at the edge, you might say. It's right at the edge of the foothills to the Rockies is what it amounts to. But I went there. The year later, these people paid my way out there, and I went. And I stayed for 3 years.
Did you work on a farm, or what did you do?
Well, I worked on a farm, yeah. fact is, it was in 1953, and I got a little scar right here. I was working with, working in the fields, was putting up hay with a farmhand stacker. And there was a hailstorm coming. So myself and my half-brother had got onto the stacker and hung on with both hands. And then I had a pitchfork in the left hand. And I got a little scar right here. And I might say I enjoyed that more than, that's been one of the best things of my life.
Of your life.
Yeah, those 3 years I spent there.
The patient is back on the ward now, so we can proceed with our discussion. He's, as you have seen, a 30-year-old man whom I asked this morning if he would like to be a teacher in our seminar. And I was very surprised by this patient. He didn't want to ask a lot of questions about what kind of seminar it is, though I tried to get it in. And he said very quickly, okay, at what time is it? And I told him about the television. And that, too, he accepted very casually. And at the end, he said, is there anything else you want to ask me? And I said, no, I just want you to understand what the seminar is all about. And he says, okay, it's nothing to get nervous about. And I had a lot of feelings about him when he came in. I wondered whether this was a man who is really not very verbal and just, accepts everything, fait accompli kind of, and doesn't really want to talk. So I had some peculiar feelings, and I wonder, this was my gut reaction to this patient before the interview. What was your gut reaction? And by gut reaction, I mean your genuine, real feelings, how you felt towards this patient. Not up here, but here.
Well, I felt rather annoyed and a little irritated by his denial. What I felt was just denial that, this diagnosis of a fatal disease made any difference to him. I didn't feel that he was really being honest about it.
Can I get your gut reaction?
Well, I think I probably picked up the same things he did, although, I wondered where his feelings were. And he made me feel more as if he was fragile, that he wouldn't be able to, in later stages of illness, be able to handle or cope with the stress that he was going under.
I think he's very kind of reacting in a very childlike way now. I'm just a tiny little person. It doesn't really matter what happens to me. And that's really very, very angry. I think there's a lot of anger behind that. Why is this happening to me? And then he keeps saying, the other thing I kept hearing him say was, after all, the doctors can't do anything about the disease. You doctors don't know anything about the disease. And I thought that was like a furious request. Why can't you help me? So.
It's amazing to me to hear the whole response from the audience in a kind of a negative way. He's using denial, he's childlike, he turned me off, and a lot of negative feelings. And maybe we start with a question of denial. We talked about the different stages dying patients go through. At first, shock and denial. I asked him, if you remember, what his first reaction was. Was there a sense of shock or horror or terror or fright or something? And he said no. And he maintained throughout the interview that there was no shock, that he really knows what this illness is, that he has read it in medical books and journals, and he even gave the odds. This man has not encountered death in his own lifetime. And though he has lost his father when he was 2 years old, he has had a stepfather, and he has had, I think, a meaningful family. Is this man in the stage of denial, really? Why would you call this denial? He gave the name of his illness. He said, the statistical odds against it. He knows that he has radiation treatment. He knows that he has surgery tomorrow.
Well, the thing that concerns me about his attitude now, I don't think I get as angry maybe as some other people, because it is a good way of coping with the illness, and it will keep him functioning outside the hospital. The disturbing thing is that he is smoking cigarettes when he knows he shouldn't be, and makes me wonder how well he will cope with his illness. He knows he shouldn't be smoking cigarettes before the operation. In fact, he implied they almost called off the operation because of that. And yet he went ahead and did it. So all his intellectualization is only partly successful, I think. I don't...
What you're saying, perhaps, is that you wonder what kind of a patient is he from the physician's point of view. He knows he should be reasonable. He knows he should stop smoking and perhaps drinking 15 cups of coffee a day. And he's having a hard time. In fact, he sneaks a cigarette in once a day. Well, if you're a good smoker, like I am, who smokes 15 to 20 cigarettes a day, and from one day to the next you're told not to smoke anymore, that is very, very hard to do. And I think it just shows, as far as I'm concerned, that he's very human, that he's not superhuman. He cuts it down to one cigarette and he feels kind of concerned that the doctor catches him. But he doesn't smoke as many cigarettes that it's really a hazard to his health. And the operation will take place tomorrow. When I told him that we are interested in learning a bit more from our seriously ill patients about what it's like and how they viewed life and death and how we can be more helpful to them, he said, death is part of life. What is there so big about it? And that's why, I was wondering what kind of things this patient would be able to bring out. And that's why I looked for previous events where he got close to death that made him see death as part of life. And this man has not had this. This man also doesn't have intrinsic, deep religious faith that teaches him through the church that death is part of life and there will be a thereafter, and life is really not finite, but will continue in some different form. We didn't get that, like we get this sometimes with the fundamental religious people. And so you have to wonder how much of his almost nonchalant acceptance is put on. Is this denial? Or is this a genuine, real acceptance? And if it is acceptance, where did this man get the strength at age 30, having malignancy of the lymph glands, and having perhaps a very limited lifespan, and having 3 small children? Where does he get the strength to accept it so calmly and really peacefully? My feeling was that this was not put on, that this was not phony, and that this was not denial. And I not only had a lot of very positive feelings, but I really admired this man. And I think the reason for this is that he represents one of these few rare people that you nowadays see in the city, that you would expect to see when you're 80 and 90 years old, who can say, I've had a meaningful life, I raised my children, I have worked hard, I've had a fulfilled, meaningful life, I am ready to go. And that's very rare nowadays to see in a 30-year-old man with small children. To explain to you why I really believe that this man sees death as part of life and can take it so calmly and peacefully now, is if you listen to this man, what he said about his early memory and his last statement in the interview. This really gives you the cues. What did he say about his earliest memory? He said his relative, great uncle or something like that, gave him a ride on a buggy or whatever you call that through the country before he went to school. And what was his face like when he said that? A happy, genuine, peaceful memory of real good days. Somebody was there, somebody made him happy. Something was very, very wonderful and worthwhile. This was his earliest memory of his life, that it was a meaningful, worthwhile kind of life out in the country, that somebody took him along even way before he went to school. And then his last recollection, the last thing he brought up, was his memories of vacation in Alberta in Canada, and what is the meaning of this anecdote that he told us about the hay wagon and the storm. You're happily working in the farm, you're happily working in the country, you're putting together the hay and pile it up on the wagon, and then suddenly something hits you out of the blue sky, a big hailstorm. And what happened during this hailstorm? Did it destroy anybody? Did it kill anybody? Was it a detrimental kind of an incident? Somebody tried to hang on, like I'm sure when you're hit by a fatal illness, you try to hang on and make it go and get to treatment and try to not fall off. And he got hurt with a fork. What do you call that, a fork?
Pitchfork.
He got hurt with a pitchfork, and he's left now with a little scar. But looking back at Alberta and his time in Canada, he says it was the most meaningful, happiest time of my life. See, this is one of these rare, as far as I'm concerned, beautiful people who have reached a stage of acceptance before he's dying, who views death as part of life, and when it happens, I will be ready for it because my life has been meaningful and worthwhile, and I'm very insignificant. He said, I'm one of a million. If I were a big shot, I would worry perhaps about those things. Like he said when I asked him about the wishes, if I had a lot of money, maybe it would be great, but who gets ulcers? Who worries is the guy who has money. So I'm going to remain a simple, in a way, perhaps a farm boy, who has little, but also little to worry about. And for this man, death is part of life, and he accepts it, just like now he accepts his surgery tomorrow, like he accepted a test that didn't take. And to me, you know, to see people in this century who still have this sense of acceptance is a very great experience. You can't see him this way. You cannot accept that, can you? Is it conceivable that you all have a sense of unreality, that this is really expecting too much, that this can't be true, and perhaps even a sense of envy that this young man, who is just a bit older perhaps than you are, has reached this stage while you are still struggling with this I am important, I don't want to leave, perhaps I'm not even finite. I'll leave this to you to think about, but I think we have to be very, very aware of our own wish to deny the reality of death. And if we do see a young patient with this degree of acceptance, it does something to us too. I think this man's biggest need is to be accepted for what he is, to be informed ahead of time when tests are done, and to be very open and frank with him. And I have a feeling that this man is going to make it without any great turmoil. I wanted to read something to you before we finish the seminar, which is perhaps a best description of our own inability to accept the reality of death. And I'm taking it out of a book of Joseph Matthews, who describes the death of his father. And I'm just reading you a few lines which I think highlight our attempt to cover up the reality of death. He writes, "To symbolize the dignity of our father's death, the family thought to clothe him in a pine box and to rest him in raw earth." Then Matthews describes later on what happened at the funeral. "I did not want to see my father until I could have some time with him alone. Several hours before the funeral, I went to where he waited. I can scarcely describe what I saw and felt. My father, I say, was 92. In his latter years, he had wonderfully chiseled wrinkles. I had helped to put them there. His cheeks were deeply sunken, his lips pale. He was an old man. There is a kind of a glory in the face of an old man. But not so with the stranger lying there. They had my papa looking like he was 52. Cotton stuffed in his cheeks had erased the best wrinkles. Makeup, powder and rouge plastered his face way up into his hair and around his neck and ears. His lips were painted. He looked ready to step before the footlights of a matinee performance. I fiercely wanted to pluck out the cotton but was afraid. At least the makeup could come off. I called for alcohol and linens. A very reluctant mortician brought them to me, and I began the restoration. As the powder, the rouge, the lipstick disappeared, the stranger grew older. He never recovered the look of his 92 years, but at the end, the man in the coffin became my papa. Later on, he describes what happened at the cemetery. I say I smelled the fresh earth. There was none to be seen. What I did see is difficult to believe. I mean the green stuff. Someone had come before us and covered that good, wonderful raw dirt. Every clod of it with green stuff. Everything, every scar of the grave was concealed under simulated glass. Just as if nothing had been disturbed here. Just as if nothing at all were happening. What an offense against nature, against history, against Papa, against us, against God. I wanted to scream. I wanted to cry out to the whole world. Something is going on here. Something great, something significantly human. Look, everybody look. Here is my father's death. It is going on here. The banks of flowers upon the green facade only added to the deception. Was it all contrived to pretend at this last moment that my father was not really dead after all? Was it not insisting that death is not important, not a lively part of our lives, not thoroughly human, not bestowed by the final one? Suddenly the great lie took on cosmic proportions, and suddenly I was physically sick. I'm only reading excerpts of this paper, but I think this is one of the most beautiful and tragic descriptions of our wish to conceal and to avoid looking at death as part of our life. And the man who wrote this about his father's death, I think felt very much like this patient we had seen in the interview today.